The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Welcome to our December webinar. Happy holidays to everybody. My name is Cynthia Peña, and I'm managing the Sweet Success Resource Center. Today's topic is an update on our affiliates and Resource Center, our scope of work, and some of the information that we've been receiving. In particular, I would like to talk to everybody a little bit about the memorandums of understanding that we've received, our site surveys, and this is all of the information that we received as of June 30th of 2013. I would also like to go over some of the deadlines and activities for the affiliates, some questions that I've received more than a couple of times from our affiliates. I'm hoping that if one affiliate had this question, more people did, and we'll be able to give you some useful information. There's also a couple of new articles and commentaries that have just been published that I thought were really interesting and might be useful to you. And then again, some changes to the Resource Center activities. Okay, so the first thing that I wanted to share with everybody was that we have 165 active affiliates, and this includes our satellites. And as you can, excuse me, on this map, the red number next to the county is the number of affiliates in that particular county. As we have affiliates in 38 of the 58 counties, so that means that we have 20 counties with no affiliates. So as I was looking at the map, I noticed a couple of things that I found interesting. The first was there is a big geographical section right here that has no affiliates. As I was exploring a little bit more, I noticed that this whole region is only responsible for about 1,300 births in a year, but it just seems to me to be such a vast geography that there's no affiliates in, and I just thought it was interesting, so I thought I'd share that with everybody. The other thing that kind of piqued my interest was Fresno. We only have 2 active affiliates there, but Fresno is responsible for about 16,000 births every year, and 60% of the births are to Hispanic women, which is a high-risk group. So I was wondering, are all these people going to Merced or Kings or Tulare, or is this an opportunity that we can take advantage of? So, I don't have answers for everybody. I'm just kind of asking some questions, and maybe in the new year we can all work together to answer some of these questions and improve our service. The other thing that I wanted to share with everybody is our affiliate staff makeup. 53% of our staff is nurses, 35% is dietitians, 9% is other, and that includes physician's assistants, for example, and only 3% is BMS, social workers or MFTs. There are 8 hardworking people out there who are at multiple sites. Thank you very much for your work. The next thing that I wanted to share with everybody is the information that I received in our site surveys. So we received 95 surveys, which covered 124 sites. 60 of the surveys submitted had complete data. Oop, that should say data, not date. 16 did not provide any client information, and the rest had partial data. So I'm telling you this because I want you to look at the data with a little bit of a caveat. You know, this is not everything. This is not all of the data that's out there. It's just what I've received. So over the year, we saw 19,568 patients. Wow, that is a lot of people. And thank you very much for your hard work. That's a lot of people to see. Of those people, 2% are type 1s or were type 1s, 10% were type 2s, and as expected, 88% were gestational diabetics. And one of the things that I thought was interesting is that 23% of the type 1s that are being seen were listed at one affiliate site. Again, keeping in mind that this is partial data, I'm not sure why we have such a large percentage of our type 1s at only one facility. I don't know if that's a function of the data that came in and the data that didn't come in, or if this one poor affiliate is seeing so many of our type 1s, and maybe there's something that we can do to help that affiliate out. The type 2s and the GDMs were more evenly spread throughout the state. So the next thing that I thought would be interesting was to see where our patients were, what counties and how they were distributed. So the counties with the pink areas, they saw anywhere from 1 to 250 clients or patients as a county. So all of the affiliates in Plumas County saw less than 250. All of the affiliates in San Bernardino together saw more than 1,000. We don't have any detail on, I didn't have enough detail to go back and show you exactly which affiliates were doing what. What I can tell you is that as a county, as little as 6 patients were seen and as many as 2,000 were seen. So one of the things that I did notice is that there's a couple of mistakes that kept coming up over and over again. Some of our affiliates were under the impression that the MOUs had transferred from the old regional programs, and we had a bit of delay getting everybody's MOUs in. We also had some question about who was supposed to be doing what, where, and when. Hopefully we've addressed all of those and we won't have that as an issue this year. Some of our affiliates thought that there were going to be no data collection requirements. That is not correct. The data that we're asking for is minimal. What we're asking for is numbers. How many patients did you see total? How many were continuing patients? How many had type 1? How many had type 2? How many were GDMs? Some of the questions on the survey were answered differently by different people. For example, we asked for a training name and date, and some people told us which webinars they had attended, and some people told us the original Sweet Success affiliate training that they had gone to. And then the number of patients that were reported were not consistently or uniformly reported. Some were based on delivery, some were based on patients served. So what we've done is we have reworded the questions on the survey so that they are more specific. For example, the new survey says name and date of webinar attended. So we're telling you specifically what we're looking for, and the same thing with the number of patients that we're asking for. We are asking for the patients served. So one of the things that I have done is created a sample data collection sheet. I've got this both as a PDF and as an Excel spreadsheet. If anybody's interested in seeing these or in using these, let me know. But I created this one just as an example of what you could use to collect your patient information. Fairly simple, just a few columns: date of first visit, expected date of delivery, what type of diabetes they had, and then the last visit. So this first group, these would be reported in the continuing from prior calendar year category. These in blue would be in the new category. And then this is our summary down here. So this information would then transfer to the site survey form itself, and these are the numbers that we're seeing at the bottom of that other page. So one of the questions that I would like to ask you when you are doing your evaluations is, in the comment section, keeping in mind the information that you already are collecting and all of the stuff that you're reporting to us, what would you like me to to give you back. What information would help you in your reporting? What would help your program? Is there anything that I can do to help you with the numbers that you're seeing and with the data that you need to have to support your programs? Okay, some important deadlines for 2014. The 2014 MOU and the site survey, which is reporting the 2013 data back to us, are due January 31st, 2014. Both forms are already online. They are in the Affiliates tab under Forms, and we have added a few examples in there, so you can go into the examples and see what it is that we're really looking for. An important change that you need to keep in mind here is that the affiliate certificates will not be, you will not get your affiliate certificate until I have both of these two forms submitted to the Resource Center. And I'm actually going to mail you a hard copy on nice parchment paper that you can display someplace in your clinics.